You are listening to Prevention is the New Cure, all things health and NHS with a political sunny twist.
That's with me, Dr. Helen Stokes Lampard, and Steve Brown, former MP and chair of the Health Select Committee.
Hi, Helen.
Hi, Steve.
Nice to speak with you. It's very warm and sunny where I am. We'll come on to where you are in a minute. You are listening to Prevention is the New Cure, as I say, episode 33 we're recording here, Helen. Last time it was Men's Health Week, a couple of weeks ago. Gosh, time flies, doesn't it? We were
I
talking
know.
to Toby Freeman, who runs something called the Robbing Cancer Trust. Really interesting, talking about testicular and ovarian cancer and tragic story of how he lost his brother Rob Freeman. But what an amazing, inspiring story in a way.
It really was interesting, and because in a sense what happened to his brother was a really rare presentation and a rare problem, but actually it sparked him and his colleagues to set up this charity, which is taking a commoner problem, which is testicular cancer, and then expanding it to the other type of germ cell cancer, ovarian. So really different, original, and I love the work they're doing going into schools. They've got such a fresh, honest angle on it all. They really appeal to younger people. It was great.
Yeah, I think he brought down the average age of our podcast participants significantly. He was quite cool as well, wasn't
He
he?
was very cool.
You
Yeah,
know what I
yeah, he
mean?
was. Yeah, he
I
was. He
feel like
was.
I have a bit of a man crush on him, actually.
Oh, that's okay. That's allowed. That's
It's
okay.
nice, isn't it?
It is. That is
Yeah.
nice. Yeah,
Anyway, we like to play Where in the World, don't we? Um,
we
where
do.
in the world is Helen today?
Well, Steve, today Helen is speaking to you from the Costa del Sol. I'm actually visiting the in-laws who live out here, so just about half an hour's drive away from Alicante, in a very nice little expat area, the Rojales district, for those who really want the details. And I'm recording this actually in their, what they call an underbuild, I think, which is a fancy name for a basement or a cellar.
You're in the
which is
basement. Yeah.
I'm in the basement. I've been relegated to the basement, but it's lovely and cool down here, even though it is crazy hot outside. So although it's warm in the UK, I raise you a few degrees, and yeah, but hey, it's not a
Well,
competition,
it
right?
is warm in the UK. It's so warm I'm wearing shorts, and I actually played golf yesterday, and I didn't take Monty the dog because
Wow,
he's
too hot.
such a black Labrador and he's such a
Oh,
puppy, and he just can't control himself like a
heat
child.
magnet. Yeah.
So he would run for 4 hours,
Oh God.
and obviously that's dangerous for dogs. So
Yeah.
I couldn't take him, and he was when I left yesterday morning with my golf stuff. He knows
Yeah.
full well where I'm going. He was absolutely devastated.
Oh, bless
So
him.
there you go.
Bless.
You've got an early Monty
Well,
update.
husbands and in-laws are out walking the dog here as we speak because it's not too hot
Yeah,
here yet.
do it
It'll
early
begin hotter
doors.
then.
Yeah.
Early doors, absolutely. Yeah, yeah. So, but they've gone to make sure I have the full reign of the Wi-Fi while they're away.
Very good. Very good.
Very organised. Right. Steve, I have to say, you're not quite looking at your perky best at the moment. Are
I'm not
you?
perky best. I've got tonsillitis,
Oh,
which is
bless.
most unfortunate, isn't it? I just started
That's
feeling. I
wretched.
thought it was. Yeah, I thought it was hay fever last week actually, and I started feeling congested and rubbish. And as the week wore on, I thought this is just not going away. The most incredible sore throat. And do you know what? I had my first experience of a little policy that I may have had a hand in creating back in the day called Pharmacy First,
Oh.
and I phoned. Do you know what? I know that your profession gets knocked about for all sorts
Mm-hmm.
of political reasons.
Mm-hmm.
And, the common wisdom out there is you can't see a GP. You're more likely to win the lottery than see my GP. Some guy said on Channel 4 News the other night. Do you
Mm.
know what happened on Friday morning, Helen? I phoned my GP surgery in London. I said that I really need, I think I know myself pretty well. I know what it is, and I know what I need. I've got white spots on the back of my throat, and they said, okay, we'll get somebody to phone you back. Within 2 hours, I had a phone back from the community pharmacist who works with the thing, working on
Mm.
Pharmacy First.
Yeah.
Prescribed what I need, sent it by electronic prescribing service EPS to my nominated pharmacy, which was just down the road. Within probably an hour and a half of that call maximum, I had taken the first tablet.
Yeah.
And you know what? And then my son has also picked it up. And so he has a different surgery down here in Hampshire. We phoned them on Friday afternoon and said, look, we just want to try and nip it in the bud before the weekend starts. They said, pop over now. Within an hour of that phone call, he'd seen the doctor and had the prescription. So, I get it that it's popular to knock general practice and knock the NHS and say that Britain is broken. And I'm sure there are plenty of instances where people struggle to get access to primary care, but I can only speak as I find. And you know what? Pharmacy First was marvelous. And the lady who helped me on Pharmacy First, she said, "Oh, I didn't want to say because obviously you're a patient, but she said I did recognise your name." And she said, I just want to say that I listened to the podcast."
Well, can I just say huge thanks to her for, first of all, doing her job properly and treating you like a patient first, and only then saying afterwards about the podcast. But we're delighted that people do listen in. Steve, thank you for being generous in your comments about both the Pharmacy First team and the GPs surgeries involved in the process, because you're right, everyone gets an absolute hammering and most of it is grossly unfair. And what we do know is most of the criticism comes from people who don't engage with or don't need the NHS. For those who engage with it regularly, their satisfaction, particularly once they do have contact, is very high. Of course, we have massive challenges around funding and workforce, because if we had those sorted, then we would give a fantastic service to far more people. But as I've said many times before, the individuals who work in the service only want to do a good job. That's what people are there for. It's the other factors that hold us back. But anyway, get well soon, dear
I think it was what
buddy.
you said when we were talking about patient satisfaction surveys earlier this year, is that they are based on patient patient opinions, not patient experience.
Yeah.
And I'm pretty sure that you talk to people, what do they think of MPs, and they would have a pretty low view. What do you think of your MP? I'm knocking on quite a lot of doors at the moment in my former constituency, and people are just so lovely to me, probably because they're seeing the back of me. But people are so lovely to me because joking apart, because I've helped them, and so their lived experience of MPs is, it jars with the reality of what they hear on the media every day.
Yeah.
So negative mindsets, Helen, they're
absolutely
never good.
I have to say, much as I love much of our media, our professional media, and what they do, this relentless knocking of certain groups is just so damaging and so unhelpful. Anyway, let's move on. I've lost the picture of you, Steve, because I'm working on a little laptop.
So basically, we have got a general election on July the 4th. Did you know that?
Do you know, it hadn't escaped my notice. In fact, it's everywhere you look and breathe.
And one of my great sadnesses of this election campaign is that, there hasn't been as much scrutiny on health policy as you might like. Yesterday here in the UK, on Monday, Labour Party were talking about dentistry places, which is good. But and partly this is the media's fault, and partly this is my party's fault, because my party keep making mistakes. And you got the D-Day debacle. You've now got the situation with these bets being placed on the election, which is the next thing the media are obsessing about. So what they're not obsessing about is the detail. And if the polls are to be believed, in less than 2 weeks' time, there's going to be a new Labour government, and we know very, very little in actual detail about what they would do. And that is a problem. So manifestos are an opportunity, I suppose, for us to have a look at that and have a look at the health pledges. And that's what I thought we would do this time. So the Conservatives came first. I think it was on the 11th of June. Seems like an absolute age ago now.
It does.
Launched their manifesto, and followed by the Labour Party, and followed by the Lib Dems. And then the various other smaller parties have launched manifestos. Reform call it a contract, which irritates me. It just irritates me because it is just a manifesto. So, if you look at what the Tory party are saying, they're talking about more increases in the NHS budget, more increases in social care, talking about building 100 new general practices in England and modernising 150 more at a cost of £180 million, 50 new community diagnostic centres, which I know are helpful, expanding Pharmacy First. So some 20-fold increase in the Pharmacy First budget is what we were just talking about, is in the Conservative manifesto, and then extending that to, contraceptive advice, menopause support, acne, chest infections. So extending the 7 conditions, if you like. And then, of course, it comes down to numbers. So we're talking 92,000 more nurses, 28,000 more doctors by the end of the Parliament, a lot more money spent on mental health, access to talking therapies, etc. Talking about funding it by employing 5,500 fewer managers and saving £640 million from consultancy spending in government. Now, that It's a lot easier said than done. So just taking the Tory manifesto first, and then we'll focus on the
Mm,
Labour manifesto
mm.
because let's face it, all indications are that that will be the manifesto that's taken into government. Building 100 new general practices in England, it worries me, Helen. It sounds a bit like 40 new hospitals. Where are they going to go? Who's going to staff them? Who's going to be the admin support behind them? And,
Well,
is there actually the necessity for it?
if I can unpick it a bit, there's absolutely the necessity for more than 100 or probably 1,000 new general practice buildings, but whether they represent brand new additional surgeries is not clear to me. So if it's 100 new buildings, then yeah, that's great. There's plenty of terrible old GP buildings that should be knocked down, demolished, condemned, or sold off for other purposes. But if what they're suggesting is 100 additional surgeries, which include the additional staff to go with them, you're absolutely right. I mean, we're short of people generally. There's no money to employ people, so buildings are useless unless they're staffed and serviced. So I think that's the key doorstep question for me on that pledge. I mean, I think, but if it's just for the buildings, absolutely. I mean, the problem you'll have is you have GPs fighting over themselves as to bid for these, to say, please, please build me a new surgery. Man, it's terrible. Because if you remember, the challenge of general practice building ownership is that we're in a right mess. Things started back on the foundation of the NHS, where GPs mostly worked out of a room of their houses. That, as time went on and demand got greater, wasn't fit for purpose. And so they tended to buy additional premises to work from. And then in time, the NHS built some properties, and then GPs raised funds, took out mortgages to purpose build some places, and they went into private finance initiatives to have buildings. You've got a right mess, a patchwork of things at the moment. My own practice, a very large one in Staffordshire, and mostly we work out of an NHS owned building run by NHS Property Company, who charge us rent and bill us for various services. And then but we have two other buildings that we've bought ourselves, a house nearby, just because the surgery was too small and NHS Propco couldn't help us with expanding the building they own. So we bought a nearby house, which we do administrative and education work out of. And then we have a branch surgery in a run of shops a few miles away, which we own. So we're a hybrid setup, and we're one of the simplest ones.
Yeah, well, I mean, look, it does say 100 new general practices and modernizing 150 more. So, that would suggest that we're talking about new ones. And, a bit like the new hospitals program, there are plenty of hospitals that actually need rebuilding. That
Yeah,
doesn't mean that they're well, they are a new hospital, but are they an additional hospital, I suppose
yeah,
is
yeah,
the word.
yeah.
So,
But
there is there
lots
is
of
plenty
demand.
in the Conservative manifesto. It's not like they're not they coming forward with new ideas. They are. In terms of what we're interested in terms of prevention, well, they say that they will return to the smoking legislation.
Yes, the
I,
vapes
I
bill.
feel no pun intended. I feel burnt by that because,
Yeah,
of
I know.
course, it is the outgoing government that has ditched it.
Mm.
So I'm struggling with that a bit. I mean, there is nothing in there that talks about returning to the child obesity battle, returning to the
Uh,
policies around the watershed, um, and a
I
lot of
think
the stuff that we talked about before.
did I hear that they were going to finally do the major conditions strategy was finally going to see light of day? Because that's another thing that's got delayed by
Yes,
all this, isn't it?
so the major condition strategy was imminent to be published when the
Uh,
election was announced. And to be fair to the Department of Health, they just have to go on with their work. They don't necessarily know what number 10 are going to do in terms of announcing election date, God forbid, or they'd have been down the bookies. But anyway, yeah. So the,
naughty.
the, the major condition strategy was almost ready to go, is my understanding. But of course, things move on, don't they? And time moves
Yeah.
on, and who knows now if the Conservatives are re-elected, whether they were what that would look like, and would there be a rethink, and would a new health secretary, which almost certainly would be the case, would they have a different view on major condition
Yeah.
strategy? Might they, for instance, see sense on there being a cancer strategy as well?
Yeah, I mean, there's the other thing I'd spotted in the Conservative one, then we really must move on to Labour, is more digital health checks. I think they were talking about expanding the digital health checks program to another 250,000 people. So I know there are real mixed views amongst sort of medics who have quite a sort of scientific bent out there about the value of health checks, the evidence-based value, because it's a sort of screening, and it depends whether you think about it as screening or a check, and there's a big philosophical argument. I think the vast majority of people would welcome the opportunity to have a health check as a bit of an MOT.
Well, yes. I mean, the thing is, though, I think the gulf between the NHS health check, which I was eligible for when I hit 40. I
Hmm.
didn't actually get contacted
No.
and to have one until I was 45.
Yeah.
I'm now eligible for one since I've turned 50. I'm
Mm.
not holding my breath. And really, the truth is that I was with some school friends the other night.
Mm.
The NHS health check is a bit of BP. You take the bloods, maybe a small physical examination, but not a full one, and that's it. Whereas
Yeah.
I was talking to somebody else who works in commercial sector who was going for his private health check. You're talking full exam or prostate examination. There is a complete gulf there between that in terms of its then ability to be a preventative measure and pick up early signs of disease or problems, isn't
Yeah,
it?
although in fairness to what the people behind the health check are trying to do, they are tackling the big killers. So they're talking cardiovascular disease. So, checking blood pressure, checking for cholesterol, and checking for heart irregularity, so pulse irregularity. So, those are three of the big ones. And your weights are checking for height, weight, so measurement of your, whether how obese you are or not, and the lifestyle stuff. And those all collectively actually have a far greater preventative benefit than picking up on some of the other more nuanced stuff. And you're absolutely right. If money and time were not a problem in the NHS, haha, then of course wider health checks. And in fact, I had a really interesting debate with our patient participation group at my GP surgery recently about whether all men should have a baseline PSA test at a certain age, say 50 or 40. So they've got a benchmark from which to measure later on when they do get problems. And I was arguing about the evidence base and the population level, and they were very good at bringing me right down to yes, you're talking population level, Dr. Helen, but I'm talking the specifics for the individual patient. For the individual patient, it's very easy to argue with the benefit of having a baseline set of values. At a population level, you may not be able to argue it. And that is the tension we always have. I mean, our prevention is the new cure mantra, covers all sorts. And the challenge between population prevention versus individual is one that will rage and rage. Anyway, let's move on.
Yeah, I correct myself. The Conservative Manifesto does actually say that we'll tackle child and adult obesity and legislate to restrict the advertising of products in high fat, salt, and sugar. So
Oh, good.
I'd missed that. It does say that, but we have heard that before. I wrote it in the Child Obesity Plan in
I
2018,
know.
and it hasn't yet happened. But then
Yeah.
it worryingly says that we'll gather new evidence on the impact of ultra processed foods to support people to make healthier choices. Don't like that. The evidence is absolutely crystal
Clear.
clear, staring us in the face. And
Yeah.
it sounds to me like that's talking about finding evidence to go another way round. We
Flim
can't go
flam.
another way round. We have to reformulate foods to
Yep.
to tackle those that are high in fat, salt, and sugar, as we did with the sugar tax.
Yep. Amen to that. Right. What are
Yeah.
Labour saying, Steve?
Well, I mean, gosh, to
Lots.
be fair, we've talked about Labour before. They are saying lots. We talked about their 5 missions for government, didn't we? That they
Mm.
published last year, of which there was a lot on prevention. And I said at the
Mm.
time, credit where it's due. Pleased to see that. The
Mm.
health warning, I suppose, on it is, when you're in government, and been there, done that. It is very, very hard to get the attention of number 10 and number 11 in particular for things like population level health interventions. And the proof of the pudding will be whether Prime Minister Keir Starmer, if that's what happens, is able to carry that kind of focus into government when he's dealing with, international affairs, and
Yeah.
being First Lord of the Treasury and the Houthi rebels and Gaza. That will be the challenge. But in terms of stuff that is in their manifesto, I suppose headlines tackling elective care waiting lists. So, the Prime Minister's big
Yeah.
pledge about waiting lists.
It's going to be hard, but
So
yeah.
it reiterates its pledge to create 40,000 more appointments a week for operations, procedures, outpatient appointments, and investigations. But if you think that the NHS does 145 million of them a year, then that we're talking only less than a 2% rise in what we're
Mm.
saying there. Given that more people are coming in all the time, and the size of the elective waiting list rose again last month for the first time in 6 months, is that
Yeah.
going to be enough? Now, the prominence of that commitment from Labour is no real surprise. They've
Yeah.
talked about it a lot. it's the how with all of these things that I
Yeah.
think I'm circumspect about. So they talk about incentivizing staff to carry out additional appointments by pooling resources across neighbouring hospitals to create shared waiting lists, and by using spare capacity in the independent sector.
Yeah.
Now,
That's
do
big
you
for
know what
Labour.
that means, Doctor?
Well, I'm guessing that that means that Labour are being quite open about their use of the private sector to support the NHS. I guess that also means getting clusters of hospitals to collaborate, forcing them to collaborate to help one another out with their waiting lists, which is something that's been historically difficult to do. I think from a societal point of view, it's got a huge amount of merit, but actually trusts and the financial system that the NHS works in has been quite competitive, and this is enforced collaboration, I think. What do you think it means, Steve?
Well, I think it means getting the same people to do more. And,
Yeah.
we have been there, of course. When I was at the department with Jeremy Hunt, we talked about
Mm.
the 24/7 NHS.
Yeah.
And,
Yeah.
that was particularly
I'm at
challenging.
work,
So,
Jeremy.
yeah, spare capacity, whether that's in the private sector or whether that's evening and weekends in the NHS, I think it relies on the same doctors working in the NHS 24/7. And,
Mm.
I don't see the chair of BMA Council, Phil Banfield, who
Mm. I do.
has said that it will be extremely hard to clear the NHS waiting list in five
Yeah.
years.
Yeah.
And to be fair to Labour, what they've learned, I suppose, is from the Prime Minister hoisting himself on his own petard around cut the waiting lists,
Mm.
is that they haven't actually made any specific pledge on by when, on how many,
Yeah.
yeah, and therefore I think that's going to be incredibly difficult. What you've got
Mm.
is a situation where you're asking the same staff to do more
Mm.
in a in an estate that is struggling. So, without the capital funding boost that is needed, you've got crumbling estate, and you've got, operations. I've spoken to trusts many times over the last few years, as I'm sure you have, who struggle to do anything like their list because they end up with some sort of maintenance problem in the
Yeah.
theatres, and they then
Yeah.
lose a theatre.
Yeah.
So, one of the reasons why productivity in the NHS is struggling is because the capital budget is
It's
almost non-existent.
raided. Yeah, it keeps getting raided, and it's the classic thing. It's actually capital estate and education are the budgets that get raided to provide frontline core services. And if you ask a patient who's sick and unwell what they need, what they want is to be treated ASAP. Um, it's the medium to longer term stuff about the buildings and the training for the future that are at risk, because they it's that's jam tomorrow, and what people want is their jam today. And so anyway, I think
So
these pledges are good in principle, but you're right, they'll be flipping hard to achieve. And for me, it's about realism for NHS staff about what sticks are going to be used to beat them to deliver this, versus what new resource will be put in to support it. And I'm not just talking about money, I'm talking about the people and estate. Yeah, difficult, but I mean, it's definitely the right ambition. I don't have any argument with the pledge.
Yeah, no, it's a right ambition. I mean, so I suppose sitting at the heart of everything is always workforce, and
Yeah,
the Labour Party say they're committed to the government's workforce plan, but with
which is good.
regular updates to it, which is good.
Yeah.
Independent workforce planning they talk about, but of course they also talk about ending industrial disputes. Okay, if only we'd thought of that.
Oh
So
gosh.
look, the junior doctors want 35%. The government have given them 9% plus an extra 3%, so 12%. So when people say,
Which is
what
upsetting the nurses.
yeah, when they say, well, what we'll do is we'll get in the room and we'll discuss this, and that will end the strikes. I mean, at the end of the day, you can only it's where between 12 and 35, isn't it? Where do you, because if they won't accept anything other than 35, and Wes Streeting has been very clear they won't give 35,
Yeah.
and the government are offering 12, well then, it's where between 12 and 35 does it land? Because it's somewhere between there that you end up ending industrial disputes, because without that, I don't see how you're going to get anywhere near touching the elective waiting lists.
No, I mean, we were going to talk about this later, but as we're talking about industrial action, we should really pick up. There was good news this week that the SAS doctors, so these are nothing to do with our military expertise, but these are the specialty associate specialist doctors in England who've accepted a payoff and avoided taking industrial action.
Saw that, yeah.
Yeah, so they are the classification of doctors who are not conventional NHS consultants, and they're not doctors in training. They are a wide range of doctors, but many of them incredibly experienced and very senior doctors who will provide a huge amount of core service in hospitals, very almost unheard of in general practice, but a very important, a massive and increasing proportion of the hospital workforce. In fact, within a year or two, they'll be the largest single group of doctors in NHS hospitals. So actually huge relief that they've avoided industrial action, because they are the ones that provide the biggest core service when it comes to operations and outpatient
Yeah.
clinics. So
People don't
that is
often
something.
know about them, do they?
No, they don't, and they're an amazing group, and I've worked with and done various conference and talks with, and I think they're rising to prominence a lot more, as I think their numbers have swelled so much, because there are a lot of junior doctors who don't want to be consultants, because that comes with certain managerial responsibilities and so on. Actually, there are a lot of people who actually want to just do frontline clinical work, and similar to we have in general practice, we have salary doctors in general practice who are not GP partners, because they just don't want that level of bureaucracy and responsibility that GP partners versus hospital consultants. There are loads of differences contractually, but the difference between the groups clinically, we're all trained highly, all see frontline patients. And anyway, let's not get into the details of it, because I'm sure I'll have people shouting at me saying that salaried GPs are trained to consultant level general practice, but the key point is the SAS workforce in hospitals are really important backbone, and to have avoided industrial action for them is massively important in terms of waiting list improvements for the future.
Yeah, well, credit to Victoria Atkins there. On general practice, then. So the Labour manifesto talks about discussing healthcare closer to home.
Yeah.
Again, a fantastic phrase. So it talks about thousands more GPs will be trained with a quote
Mm-hmm.
guarantee of face-to-face appointments for
Mm-hmm.
all those who want one, and a
Mm-hmm.
modern appointment booking system to
Mm-hmm.
end the 8 a.m. scramble. There's a
Yeah.
promise to quotes bring back the family doctor. Did they ever go away? By allowing patients with ongoing or complex conditions to see the same doctor for more continuity of care.
Mm-hmm.
Okay. I
So
had
look.
issues here with guaranteeing this face-to-face appointment. My example at the start of the program about Pharmacy First and my sore throat, I didn't need that face-to-face appointment. The wider team did what I needed. And I'm
Yeah.
just concerned about people who don't need that being guaranteed this face-to-face appointment. It's surely setting themselves up to fail, isn't it?
I have to say, in my practice, obviously all practices worked virtually for a huge part during the worst of the pandemic, and then we gradually evolved back. In my practice, we've stopped fighting it. We've just said to patients, look, you can have face-to-face, you can have telephone, what do you want? And we just let patients decide. And what's interesting is that younger patients almost invariably want to have remote if they can get away with it. And at times I'm thinking, how the heck do you think I'm going to feel your breast lump if you're on the telephone? And so I have to bring them in anyway. But it's the kind of, they thought, well, is there anything we should do before you bring me in to examine me, doctor? And fine. And interestingly, particularly an older cohort of patients just like to see me face to face. I'm kind of, it's freezing cold out there. It's icy, and you have come out. You've taken a bus to get to the surgery to see me. You could have slipped twice. You've had to pay. Well, actually, you didn't pay your fee. The bus was free, but and we could have sorted this all out on the phone, and your prescription would be delivered to the house for you. But there's a real
Is it that they're
culture.
lonely?
There's a generational difference there, Steve. So, and I think that, so there's accepting that generational thing. There's a re-education program needing to be done over the years on re-education. I mean, people need to just kind of trust and understand the systems we've got in place. I mean, let's face it, healthcare professionals have struggled with the changes. What's been interesting to me is how video consultations fallen back out of fashion. Because a high quality photograph gives me far better images than a video consult does. So if you've got a rash, I'd much rather have two good quality photos than I would a video. I'll see far more. So that's been an interesting shift. Anyway, we're digressing somewhat. I mean, back to Labour and what they're wanting to do. A more modern
Yeah.
appointment booking system, amen to that. I mean, we all hate the 8 a.m. rush. It's just it's an unfortunate consequence of the way things have been set up, about way GPs are being incentivized or punished if they don't achieve certain things. I mean, there's an amazing appeal by bringing back the family doctor. I mean, I've got patients that have been, I mean, I've been a partner in my surgery over 22 years, and I am Dr. Helen to them, and I am their family doctor, and they love it when they get to see me. There are times when continuity is really important, and I ensure it happens. Unfortunately, we haven't got the capacity so that they can choose to have continuity. It has to be doctor-led to determine it. And we'd love to offer more, but there is a direct tension between the on-the-day access versus continuity. You can't have both in a mature system. You have to make compromises until you've got a far, far, far greater workforce with any sort of some spare capacity in it. And difficult. And then, because newer doctors have got to start out and get known by patients, how you can't develop the family doctor connection and continuity if you're new. It takes time. And when I started, I was the young blonde one with a funny accent because I was Welsh working in
You
England.
still are.
Thanks, Steve. Well, I'll take the young and I'll take the blonde, but
Mm.
come on. Yeah, no. But it takes time. And patients used to say, oh, so you're the new Dr. So-and-so, because I was working in the consulting room with a former senior partner. And I thought, no, I'm really not the former Dr. So-and-so. I'm the new Dr. Helen. Anyway, we digress. Back to Labour. Back to Labour.
That's they're talking. I mean, look, we know that successive governments have pledged to increase GP numbers, but the number of full-time equivalents have fallen over the last decade. So, with retention getting worse. So the big issue as ever is training and retaining. And the details on that are not there. There's talk about taking the pressure off GPs by allowing community pharmacists to do more. So, the two main parties have that in common. There is a welcome public health section, and it restates their pledges on online safety, on gambling, on smoking, on child obesity. There's a big section on health inequality, which makes some pretty broad promises on halving the life expectancy between the richest and poorest in England.
That is really bold and welcome.
Yeah, and the parties have that in common, but it's been very, very difficult to do. There's a pledge to prioritise women's health. There's a pledge to tackle the social determinants of health, which, again, I like that because it can hopefully dip into those inequalities in housing, in education, in transport, in leisure and recreation, vaccination, the things that we were doing in the prevention inquiry. And the thing about manifestos is, sometimes they can be a drag because you've promised things that you've either got to do or break, and sometimes they can be vague enough, and vague is sometimes good. So tackling the social determinants of health, quote unquote, in the Labour manifesto gives them all sorts of opportunity to dip into the prevention agenda. So that could be good.
Absolutely. I mean, there's a whole heap of stuff. I mean, I'm quite relieved about the explicit support for the smoking and vaping ban and so on. And I think there are other things about. I mean, I think we mentioned it before about the caffeine energy drinks and the junk food ads and so on, quite specifically, and that's good from my point of view. And they've had a lot of positive stuff about what was I spotted out? Although social care funding, and there was talk there, but I think that everybody has shied away from making a big commitment on social care.
Well, yes, I mean the reform of social care section has been ducked by a lot of governments for many times. I mean, Labour talk about creating a national care service. I've said this on the media before. I don't know what that means. If that means nationalizing care as the way that we did, basically the state purchased hospitals and then made the NHS in the 40s, then okay, interesting. But my goodness, there's a big price tag attached to that because social care primarily exists in the private sector. So I don't know what that means, and obviously that would be down to future ministers to set it out. The only thing I would say on what Labour put together is, they talked in their health mission last year about health in all policy, and I liked where that was going. I've discussed it with Wes Streeting before, which is that every policy should consider the health of the nation implications. That hasn't really fed through into the manifesto. Now that's to say that they may create a new department within the Cabinet Office that has to make sure that all policies have regard to the public health of the country, but that doesn't really feed through into the manifesto. I was looking to see whether that was there because prevention is the new cure. Obviously, works outside of the health department.
Yeah.
So that's where they were. On the Liberal Democrats, I mean, they announced theirs on the 2nd of June. They said they'd reverse cuts to the public health grant, which Labour do not commit to doing. That's quite a big spending commitment because, of course, that's grants to local authorities. They said they'd fund that by cracking down on tax evasion. Okay. Daisy Cooper said it's cheaper to prevent ill health than treat it. Well,
True.
amen.
Yeah. Yeah,
Who wouldn't
absolutely.
disagree with that? They announced plans to boost GP numbers by 8,000, and
Yeah,
then
very
they've said
specific.
this before: give people the legal right to see a
Mm-hmm.
GP within 7 days. For
Mm,
reasons discussed, am concerned about that.
mm-hmm.
And they said they wanted to begin to address the crisis in social care,
Mm,
and there's some big promises on some big spend on social care. I mean, look, just to say for where they're coming from on social care and where everybody is coming from on
mm,
social care is that big new sums spent by the government, big new sums promised by the opposition, Liberal Democrats talking about big new sums, but it's structural for me. So it's not all about care homes, because the vast
yeah.
majority of social care is delivered, as you know, domiciliary
In the
care
home.
in people's homes. So
Yeah.
what does that look like under a future government, and how would it be paid for? And then on the residential side, I just don't think, and Andy Burnham said this, I just don't think you can get away from the fact that you are going to have to somehow bring assets into the discussion. You
Yeah.
just are. If you're going to bring in Deal Not next year, which the government and the opposition have pledged to do, with the care on cap on care costs, then either that is an enormous cost for the exchequer, which
Yeah.
again hasn't been costed in any manifesto, or you're going to have to bring some kind of contributory cost in there from people. And the only way
Yeah.
to do that is through assets, through
Yeah.
property. And maybe nobody's being honest about that. And
Mm,
certainly nobody's being honest about that, because Theresa May tried to in a general election campaign, and look what happened.
yeah. Yeah, no, you're right, Steve. Just picking up a few other things on Lib Dems. I'm conscious time is getting on for us.
I know,
Um,
don't we
there
go
was
on?
well, we've been told that before. There's interestingly quite a lot of the Lib Dem stuff. I mean, it's stuff you really can't argue with, and mirrors things that others have said. Um, so the public health side, very similar things that we've said, but they've been more specific about dental things, about tooth decay issues and supervised training for children in nursing and schools. I liked scrapping VAT on children's toothbrushes and toothpaste. I was shocked that there is VAT on children's toothbrushes and toothpaste.
Yeah,
You
yeah.
can tell that I don't have small children. But yeah, I mean, I think there's a lot of good stuff in there. And I mean, Daisy Cooper speaks she's very articulate in explaining a lot of these things. They also put an awful lot in about mental health and mental health prevention. In
Good.
fairness, all the parties did quite a lot, but I think Lib Dems really went large on it, as it were. And they put a lot more in about cancer, which, as I know, for your concern, they talked about a prostate cancer screening program, and they very specific things about radiotherapy equipment. So there's a lot of good stuff in there. I don't think we've got time to dip into all the other party manifestos. Unless there's anything particular you wanted to pull out from any of them,
No,
Steve?
I mean, look, they're variations on a theme.
Yeah,
I mean, look, the truth is they don't have anything like the support that the big parties have to produce that kind of research.
yeah,
But look, the fact is that how I would sum it up is a lot of promises are being made about a lot of staff that will be found, about a lot of staff will be trained, about 100% of patients with cancer starting treatment within 2 months. The Lib Dems say, what Callie Palmer would tell you, that we'd love to get there, but that is a significant investment in people and capital to make that
yeah.
happen. So I think the thing about all manifestos is that they're not short on ambition. That's good, right?
We like
You don't
ambition.
want them
We
to,
like
you don't want to
ambition.
be unambitious, but equally they are very short on detail. And
Yeah.
if Wes Streeting becomes health secretary in 10 days' time, then it will be down to him to set it out very, very quickly as to how he's going to flesh out some of those promises. I mean, he will be faced, of course. There was a big interview with him in the BMJ a couple of weeks ago. The first
Good
question
interview.
he says, it was a good interview. He said the first question he'll be asking is, where are we on winter planning?
Yeah.
And then, where are we on ending the strikes? And, vis-a-vis our earlier conversation, we need to move on pay, he said. Well, okay, but, you're going to have to, it's going to cost money to move on pay.
Yeah.
Unless the BMA are just going to settle because it's a new Labour
This
government
is Labour.
and not the Tories. I don't know. But we will see, won't we? And ultimately the patient's not foolish. The patient will know whether they're getting what they've been promised.
Right. Let's move on.
Yes. Let's take a break.
Welcome back, and it's time for this. So, pod surgery's back, Steve, and I wanted to start us off with a blood test about Parkinson's disease. I'm not sure if you picked this up from a week or so ago, but there was a really interesting paper published in Nature, and it made a lot of headlines.
I did. I'm very attuned to this subject. My father died of pancreatic cancer, but had Parkinson's. So
I see.
I watched the Parkinson's journey very close up.
Yeah, as a GP, it's one of those where patients walk into your consulting room and you look at them and you think, oh goodness, are they coming to see me because they've developed this coarse tremor or their face is no longer as got much expression, or they're coming for something else? And am I going to have to broach the difficult situation that's emerging here? Anyway, so AI and AI early diagnostics, that catches the attention, doesn't it?
Yeah, catchy.
Mm. So look,
So
this
Parkinson's affects about 150,000 people a year. It's
that's
actually
right.
less than I thought, but it's devastating impact.
Yeah, and it's in the early stages people cope very well, and then later on it can become incredibly difficult. And there's an association with dementia over time, and that's really hard for people. I've got dear family members family friends, in fact, who've had it. And yeah, as you say, you saw it yourself. I've seen it close up. It's difficult, very difficult. But about 10 million people around the globe apparently, and these researchers, University College London, took blood samples and identified proteins uh, from people with Parkinson's disease and compared them with people who didn't. So found these trigger proteins, a cluster of them, which feel like are early markers of disease. So these proteins can be found in the blood long before anyone develops symptoms of Parkinson's disease. I think that's the basis of the test, is my understanding. And this AI tool helped synthesize this masses of genetic data and had a high predictive accuracy for people who would later go on to develop Parkinson's disease. Which is new and actually very exciting, although of course a long way from being something we can actually do anything with.
Yeah, interesting. And it's been published in something called in Nature
Uh,
Communications, or
yeah,
Nature Communications, it's called, isn't it?
that's
Anyway,
right. Yeah.
we got the link for that, so we'll pop that up on the podcast social medias. The other thing that caught my eye that I just wanted to raise with you,
Mm,
there was a big piece on Channel 4 News the other night about people are struggling to see a GP, which we were talking about in relation
hmm
to the manifestos just now. Yet the British Medical Association say that it's heard from locum doctors in England who are struggling to get shifts at practices. Now
hmm
locums, people will know locums are practice. They use them to cover sickness or other absence among partners or salary GPs, but
That's right.
increasingly, of course, they've been used as part of the workforce.
Yeah.
And how how can we be in a situation where some people are saying that they cannot see a GP, and yet we've got trained GPs who can't get shifts? What's going on here?
Now, this is really interesting. In fact, the story I think was broken by Hugh Pym on the BBC, but covered by a lot of the other news outlets. Um, this is a really interesting one. So let me try and explain it clearly if I can. If we'd been talking 3 years ago about the challenges in the workforce in the NHS, I would have said it was absolutely all about we need to train more people coming through. We needed to, retain those we already have in the service and value them, but we absolutely needed to recruit more people as well. Yeah, and we obviously needed to return people to the workforce who'd left. Now, what's happened is the massive effort that has gone into recruiting more people. And in fairness, I was there in 2016, where Jeremy Hunt announced that there would be an extra 1,000 more medical school places and there would be extra GP training places and so on. And these things have been coming through the system. More people are training, more people now training as GPs than ever done before. What's happening is that practices haven't got the money to be able to employ them. And we're having similar challenges in hospitals. Now, the NHS, sort of secondary care side of things, there have been big edicts that have gone out the last few years that hospitals must massively reduce their use of locum and temporary staff, but employ more fixed contract staff, fully employed staff, because although we will always need a certain amount of flexible workforce to cover, as you say, for sickness and for maternity periods of absence, what the whole NHS really needs is stability of workforce. And so this is the same is true in general practice. There was a massive expansion in the locum workforce with a very good associated salary, because you haven't got any stability. You don't get sick pay and so on if you're unwell, if you're a locum. But a lot of people chose it as, I feel like, a lifestyle choice because they found it helpful, also as a way when to work out which practices they may want to work in ultimately and settle down. What's happened recently is that a lot of locums have found that practices just aren't employing them. Practices are saying, well, actually, the money's just not there. If we've got a gap, tough, we've got a gap. It's just the way it is. There'll be fewer appointments. Sorry, patients. And these doctors are sitting there saying, but I can offer you shifts. And they're saying, yeah, we can't afford you. If you're prepared to work for us on a salaried contract, we'd be more likely to take you on because we've got stability and predictability, but we can't have the uncertainty of peaks and troughs of pay. So there is a genuine thing. There are salaried doctors who can't find work or can only find a day or two a week when they'd like to be working 4 or 5 days. But there's been a pushback from some practices who in turn have said, we don't want to come and work for us in a stable way. Let's work together on this basis. It'll be better for us all. And there's also a challenge of geography here. There are some parts of the country who will take any doctors, locum, salaried, partner, whatever, if only people would come there. So there's geography and doctors not wanting to work in certain areas. And yeah, so that's my take on unpicking that one, trying to be as balanced as I can and give about all sides of the arguments.
That's very interesting. Okay, thank you for that. As ever, perfectly explained. And final item on pod surgery is something from you.
Yeah, well, I've got a little bit of news to share with our listeners. I've got a new job. So as you know, I have 3.
You're going to be health secretary.
I've never been part of any political party, Steve, nor will I ever be. So that's a no-no. No, I am actually going to be the new National Chief Medical Officer for, wait for it, Health New Zealand. So that's for effectively the NHS in New Zealand. So it's the head of the doctor's role for their healthcare system, which I can't do based in the UK. I'm emigrating.
Yes, congratulations. So you are the new Chris Whitty.
No, it's the Steve Powys role, effectively.
Oh, you're the Steve Powys.
It's not the public health role. It's the doctor's. Okay. It's the doctor's role within the health service. Okay. There is a Chris Whitty person called Joe Bourne down there who is fab, and I'm looking forward to working with. But it's really exciting. But it's going to be a big change for Paul and I. So yeah, so we're breaking. So Steve, you and I are recording this on Tuesday, although the podcast will go out on Thursday, the 27th. And the news is going public. So Health New Zealand put out a statement today, and the NHS and University of Birmingham and my GP surgery are making statements. So we will put the Health New Zealand link onto the podcast usual pages for people.
Yeah, we'll put it on the socials so people can see that. And obviously, you know, I don't think you're going until later in the year, are you?
A bit. Visas will take ages to work out.
More of this mindless rabble to continue, but we will obviously make an announcement in due course as to the implications for what we're doing. But no, well done. And does that mean now I've got a holiday destination to go to?
Absolutely have. And if you're into rugby or cricket, then there's nowhere better to come and visit. So
I'm certainly into one of them, and I have a 13-year-old boy who's certainly into cricket, and his cousins live in Christchurch, New Zealand.
Oh, do they?
They've emigrated a few years ago. Year and a half ago. So that gives us even more excuse to come down under.
Absolutely, we can do a podcast from down under.
I like the idea of that. Yeah,
that'd be great.
Well, it all adds up now. Because you were there recently, of course.
I was.
Anyway, listen, that's it. That's it for us for this episode. My goodness, we've covered a lot of ground. I hope you've enjoyed it. Podcast at stevebryan.com. Social media, all the usual places. Find us, like us, follow the show wherever you get your podcasts, because that really helps us. And we'll see you next time, won't we?
Take care and get well soon, Steve.
Thank you very much. Keep taking the tablets. That's what I'm going to do. All right. God bless. Till next time. Bye.